Colleagues, I would like to wish you a very warm welcome to this year's annual Delegate Conference here in the wonderful surroundings of the Slieve Russell Hotel and our delayed celebration of our 50th anniversary. Firstly, I must acknowledge the fact that this day has been a long time coming. We have seen the cancellation of so many events, training and conferences over the last 2 years, and now once again we have the pleasure of a relative normality. Before the beginning of the pandemic, we thrived for the extraordinary moments in life. The nice holiday, the big celebrations, the joys of living. We worked hard to warrant the pleasures in life and set goals to achieve them, but suddenly the prospect of any of them was taken away. The nation became an insular one, a fearful one, where the most patriotic thing you could do was to stay at home. Not only was the hope of the extraordinary gone, and the mundane reality and comforting warmth of the ordinary had also vanished. Little did we know, when we last met together in 2019, that a catastrophic, unprecedented pandemic was ahead of us, that so much pain and sacrifice was waiting around the corner, and that so many would not see the journey's end. I am very conscious of the fact that I don't want to summarise what we have all experienced, a shared moment in the history that affected everyone in this room and beyond in a highly personalised way. We all shared our fears and followed the rules. We wore our masks. We homeschooled our children. We tried to balance our family commitments and our work-life expectations. We were all driven to the edge of despair and back again. These are generalised statements that can be applied to most, but beyond the everyday experience of the COVID outbreak, there were those who would be scared far deeper, those who lost a loved one. Behind every number was a human being, behind every death, a family in mourning. Resilience is what has brought us here today, and although we still face great challenges and the need to remain vigilant and responsible, our situation has improved. Nonetheless, our hospitals and approved centres and the services in general remain under extreme pressure. It would appear that there is no intention to give any credence to the calls for measures to reduce the present infection rates, but this thinking is flawed. The system cannot continue to cope with 5,000 whole-time equivalents out per week and 10,000 patients waiting on a bed. This is completely unsustainable. We knew long before the pandemic the service had deficits. They haven't gone away. What is needed is more beds and the nurses to staff them. That's the reality. If the money's not there, well, it's been spent in the wrong place then. Patient-facing, frontline staff is what is required, something that can never be achieved without proper, realistic workforce planning and an increase in graduate numbers. This is my very first address to conference as chairperson, a daunting experience, but one I will always cherish. But more importantly, what I am so grateful and proud for is the profession that we represent. Throughout the pandemic, I was struck time and time again by the simple decency, kindness and generosity of my colleagues and members. The shoulder-to-the-wheel attitude, the undying support to give each other just to simply get the job done was inspiring, but also proof that nurses are simply made different. Empathy, dignity and respect aren't licked off the street. And I wish to thank you all, and indeed every nurse, for the dedication shown and the value and pride to which you have given our profession, a profession that I am honoured to be a part of and represent. Once again, I thank you one and all. Our Nazareth colleagues have fought for over a decade now to address the inequities in their own profession and seek to apply the right to be represented by a union of their choice, the P&A. Before the onslaught of the pandemic, we had coordinated protests, political lobbying and industrial actions. The response from our supporters in Dáil Éireann was growing. A new sense of hope was flourishing. Unfortunately, that momentum greatly diminished in March 2020. We continue to support a large number of members within the National Ambulance Service and have dedicated resources to that very purpose. In fact, we are currently in a High Court action with a NASRA member, to which we hope to see a positive result in the coming weeks. The support and dedication given by the NASRA committee is outstanding and unrelenting, and they remain very much dedicated to the cause. There are many indelible rights in our society that our society affords us, and this campaign is one of them. We won't go away. We will continue the battle until there is no battle left to fight. It should not just be seen as a fight for our NASRA members, but a worthwhile endeavour for trade unionism as a whole. Although I have spoken in a general sense about the disruption on our pandemic had on our society, I have yet to discuss the effects it had on our own organisation. The close-knit environment of trade unionism and the P&A business was shattered along with the institutional setting. The movement into the community and approved centres spread our membership farther and wider than ever before. Where other unions saw the decimation of their branch structures, or the very least, the reduction of them, the P&A continued to function as an entity, ruled from the bottom up and not the top down, something unachievable without our branch committees and dedicated membership. The power of the P&A has always been from a local level. Any success ever achieved at a national front was only delivered because of the strength that we could show on the front line. That is why we need to ensure our structures remain intact. I am very glad to say that for the most part, our structures and our communication links remain very much intact. Nonetheless, we have difficulties in many areas, greatly exacerbated by the pandemic. The Rules and Reorganisation Committee have spent a great deal of time over the past few months trying to support the branches in reinvigorating their local committees and support them in achieving proper structures and communication channels with local management. We need to constantly strive for the continuation of local engagement. It is the backbone of trade unionism and the foundations of our system. Constructive dialogue, the quick chat, the ability to knock on someone's door can never be underestimated, and in many cases can be the very interaction that prevents issues spiralling out of control. I would ask that all branches are proactive in maintaining these structures and would advise seeking the help of the Rules and Reorganisation Committee to ensure that the assistance can be given. A major part of our continued longevity has always been our ability to provide our training for our branch officials. Over the years, it's become increasingly popular to the extent that we have had to move from once to twice a year due to the numbers attending. Unfortunately, that has not been possible of late. Thankfully, I'm glad to announce that training will recommence on the 25th and 6th of May. I am aware that there are many of you here today for the first time or have recently taken up positions in your local branch, or indeed are returning to the committee work. I would advise you all in particular to take part in our training programme. It is a fantastic foundation, and over the 2 days attempts to give as much useful information as possible to assist branch officers. Testimonials from previous attendees have been massively positive, and I hope this continues. Places are limited, and I would advise all to seek to book a place as soon as details are distributed. On Tuesday of last week, our Deputy General Secretary, was invited to attend a meeting with the Department of Health and DPARS regarding the special leave with pay for those suffering from COVID. This was not a meeting of consultation, discussion or agreement, but a meeting of diktat, the only purpose of which was to notify this union of their complete decision to completely withdraw all provisions of sick leave with pay for all healthcare workers from July 1st, 2022. Their intention being that from that date, sick leave will be utilised in all circumstances where individuals have COVID or COVID-19 symptoms. They asserted that sick leave with pay was a temporary measure in extraordinary circumstances and that its application was never based on any occupational criteria. They also emphasised that they were giving several months' notice in order for people to be made aware of the change. I wish to thank the Department for their compassion and thoughtfulness on the timeless and endless hours they must have clocked up in order to come up with this proposal. After all, it's been very difficult to maintain such a level of unempathetic bureaucracy while working from home for 2 years. A pleasure that nurses and other healthcare workers were not afforded during our war on COVID. At the beginning, we were told that we were soldiers on the front line of a battle against an unseen enemy, expected to do our jobs and get on with it, which we did. Soldiers at the front line are soon to be pushed to the back of the line. Thank God we have all those Thursday night round of applauses outside Dáil Éireann to comfort us now. We never wanted a clap, we wanted a support, a safety net, and now they are looking to take it away from us. Our position on this was made very clear. This decision is ill-conceived, made with no advice from any health authority or oversight groups, spits in the faces of every one of our members and removes any doubt to what level of gratitude the government has for the people they clapped week after week in our darkest hours. This cannot be tolerated and must be challenged at every opportunity. This is not an action that should be taken so lightly. It will only fuel a sense of anger and lower the morale within the HSE, especially for those of you who asked for little but gave so much. To be advised of this decision on the very week that the pandemic recognition payment details were published is extremely cynical. It is easy to see where the money is coming from. Give with one hand and take away with the other. I demand that government act now to ensure that this draconian step is not taken. As long as our members are requested to isolate following a COVID-positive diagnosis, the employer must continue to support them. The withdrawal of all special leave with pay is an attempt to place the burden of a predominantly occupational illness at the feet of those working on the front line, and is another example of the unempathetic decisions being made by the bureaucrats. We have seen many victories regarding pay and conditions over the past few years. The enhanced nurse contract, community allowances for CPCs and nurse practice development coordinators, new contract and grade for area directors, increases made and increases due under building momentum, and the return of time on 1/6 were all welcomed. Their negotiation was lengthy and fraught with challenges. We understand that things take time and proper negotiation and agreement are sometimes difficult, remaining goal-orientated always being the focus. What is, unfortunately, less reasonable is the length of time that these implementations take, these measures take to be implemented. It took from 2019 to this year to see the application of time and 1/6. What is even more shocking is the fact that its retrospection has yet to be paid in CH04, with no indicative date been given for its payment. We will bring this matter to the WRC in a hearing next week with the HSE, but it is only one symptom of a far larger disorder. The ability for the employer to implement agreements in a reasonable time frame is incredibly frustrating, time-consuming and unhelpful. If wage deductions were deemed necessary or an overpayment was due from any one of our members, every penny would be taken back in the next paycheck, but yet we have to wait years to get recompensed. This issue has been highlighted and scorned at every opportunity, but once again, I demand the HSE get their house in order. We have no intention to continue on this merry dance. Either these departments are under-resourced or we are under-appreciated. Action is required from the employer, or action may be required from us. With this in mind, I wish to mention the reintroduction of the 37.5-hour week by the end of this year. Its return is very welcomed and has been recommended by the Hours Body's report. The restoration of these hours previously lost under the Haddington Road Agreement will be funded by an additional €150 million to the current payroll. This is a long time coming. I am aware that some branches have already commenced discussions regarding its re-implementation, and I would advise all branches to do the same. Even informal discussions and preparations at this stage would be helpful and would expedite the process when the time comes. We would hope to be in a position to have more information come July, but our goal is simply to have an orderly progression back to the 37.5-hour week and to reach agreement as quickly as is possible in each area. Earlier in conference, we heard from our National Treasurer, Mr. Ollie Byrne, regarding the financial health of the Union. Thankfully, at present, we're in a very good place regarding our finances. Prior to the pandemic, we had seen a healthy growth and we were very much in a stable condition. The large reduction in expenditure over the last 2 years has added to the funds. That is why we see it as a perfect opportunity to reinvest some of those funds back into the infrastructure of the Union itself. We are very lucky to have excellent location in our headquarters in Sallins, but the building unfortunately has had no refurbishment since we moved there in 2008. We have already begun the process which will see us refurbish some internal space to make it more purposeful. We will also be rectifying the lack of ventilation within the building, something that has been prioritised even more so due to the pandemic. Currently, or so I've been told anyways, there is only one toilet in the entire building in the upstairs gents' bathroom. Or one window, beg your pardon. We hope to move further with this in the coming months, but professionals have already begun the process. I believe this work is necessary and diligent. We have no intention from moving from our current home, therefore we need to maintain it as best as possible. The current Russian invasion of Ukraine has been shocking to witness. In these modern times, it appeared inconceivable that an act such as this could have happened, but yet it has. The scenes of total devastation brought to Ukraine by the unhinged decisions of one man and his enablers is a reminder of how fragile our freedoms are and how corrupt mankind can be. I was struck by pictures sent to me 2 weeks ago. These pictures depicted Dr. Anatoly Pavlov walking amongst the ruins of the Michael Lvov Psychiatric Hospital. The building in rubbles, the windows blown away, a massive crater just behind him. The scenes unthinkable weeks before a place of healing, now a place of total despair. Their only crime being where their country lay. It could be any of us. We will see an influx of Ukraine people come to our country in the coming months, and we will be lucky to have them. Nonetheless, they need more than food and shelter. They need support and services. I call on the HSE to ensure that proper services are put in place and that the nurses caring for those suffering from severe trauma are given additional resources to make this happen. I'm glad to say that the P&A Finance Committee and the board have decided to donate to the Ukrainian cause. And we all hope and pray to see an end to this bloodshed and a return to a free and independent Ukraine in the very near future. To conclude, I want to thank all the speakers over the last 2 days, Mr. Neil Murray for his poignant tribute, Sound of Silence, Minister Donnelly for his address, the University of Limerick students, Sarah, Brianna and Danielle, Mr. John Saunders, Chair of the National Implementation Committee of Sharing the Vision, Ms. Niamh Walsh's presentation on Intellectual Disability Passport. And I look forward to the celebrations of the 50th years of the P&A, directed by Michael Hughes, ably assisted by his dad, our former treasurer, recently retired John Hughes. Delighted to see you've pivoted your way into a new career, John, with your true Spielberg style. And whilst I'm on the subject of professional production and direction, as always, we are delighted to work with Philip, Aidan and David from AVA and Diarmid from Red Dog. And Mark, our photographer. Gentlemen, it's been a pleasure and many thanks. Before I finish, delegates, I would like to say a few words of thanks and some congratulations. Firstly, I would like to congratulate all the newly board members on their successful election. Aisling Strahan, Brendan Sexton, Katrina Madden and Donald Spillane as trustee. Also, as a board, we look forward to working with Declan Duffy as the representative for the National Forensic Service and a representative from the Child and Adolescents in Mental Health. I would like to take this opportunity to thank the board members who have stepped away over the past 2 years for their commitment and dedication to the P&A. On behalf of the board and myself, I would like to wish you all well in the future. John Hughes, Tracy Quigley, David O'Rourke, Liam Hamill, Dennis Meehan, Owen Ward, and now Andy Myler. We look forward to having a drink with you all later. I would especially like to thank the board of the P&A for the continued commitment to adapt to new ways of online meetings, and in particular during the COVID pandemic, committing to weekly board meetings. This was no easy task, all while continuing to provide care on the front line. To Rory Kavanagh, I would like to wish you and your family all the best in your future career as you return to your native mental health services. We wish you well. A massive congratulations to Niall O'Sullivan on his successful appointment as IRO. I would like to thank full-time office staff Paula and Elaine, without whose dedication conference would not be the success it is year on year. Their hard work and dedication and their diligence in the office, the first point of contact for many of our members who ring with queries or advice. Your hard work does not go unnoticed. We missed you at conference this year for your professional input, but also for the fun and humour side throughout the 2 days. A sincere and heartfelt thanks on behalf of us all to Pauline O'Sullivan, who stepped up to the call when we reached out. I wish to express my sincere thanks to Caroline, Aisling and Peter for your support to myself and the board and your unique professionalism, as always. Michael, I want to thank you personally on your excellent enthusiasm and commitment to preparing me for this, my first speech. Without your support, it would not be feasible for me today to stand here and overcome my fear of public speaking. It better get easier next year. I would also like to acknowledge and congratulate not only one but two of our members on their appointments to the board of the Mental Health Commission. We are not only honoured that our own nominee, Miss Martina McGuinness, was appointed, but also that my own colleague from the Kildare Mental Health Services, Miss Catherine Kokeman, will also take a seat at the board table. I am sure you will all join me in showing your appreciation for both Martina and Catherine's hard work, and I'm certain that they will represent nurses to the highest level while on the board. Finally, delegates, I would like to thank you for your ongoing commitment to this organisation. It's no easy task to support the members on the ground. You are the foundations of the P&A, and for this I thank you. Your hard work does not go unnoticed. Thank you all. Thank you for your kind attention. For those of you heading home, I wish you a safe journey. For those of you staying with us tonight, have a wonderful evening. Thank you.